Mike from Richmond asked a question that a lot of other folks have asked as well. Why do we have to do this healthcare now? Why do we have to do this reform now, especially when times are so tough with the recession, with the other challenges we face in the nation? And the reason why I think we need to do healthcare reform now, and let's face it, we've been talking about healthcare reform since World War II, and the last time there was a major effort was in the 1990s. The reason we need to do healthcare reform now is because the cost of doing nothing is so high. I think most Virginians know that one of the things I prided on when I was governor was making sure that Virginia stayed fiscally responsible. I'm trying to fight an uphill battle in Washington now to try to bring a little more fiscal sanity back to Washington. And one of the biggest challenges is how we drive down our federal deficit. And the biggest grower of our federal deficit is our currently existing Medicare and Medicaid plans. As a matter of fact, Medicare is subject to go broke within the next decade if we don't change and reform the existing health care plans. So from a federal deficit standpoint, we've got to drive down our cost within existing government programs. We also have to drive down and take on healthcare reform now, because if you're part of the 60% of America that has some level of private insurance, you've seen your costs continue to escalate. It's been estimated that if we do nothing, if we keep the status quo, that the average family in Virginia will be paying close to $25,000 a year within the next decade for their health care costs. Well, for most Virginia families, that's going to really put them over the edge and bankrupt them. So we've got to drive down the health care cost curve if we're going to keep our economy competitive, keep families competitive, not blow up the federal deficit. And for me, that's probably the single biggest reason why we've got to do healthcare reform now and not simply putting it off.